America's doctors and nurses who are treating Ebola patients getting the same kind of preparation. Donna Gallagher is a nurse and director of public health at the University of Massachusetts Medical Center. And Donna, you've traveled to Liberia multiple times. You actually traveled with Dr. Richard Sacra, who contracted Ebola. Some healthcare workers in the United States say that they are not trained or prepared the way you've been trained and prepared. Does more need to be done?
Well, I think there's always more that needs to be done, because as much training as we've had, Ebola is not something that we see in the United States. So yes, all healthcare workers need to have the extra level of training that's required to be sure that this type of a virus does not get transmitted. And you've seen all of the procedures that MSF is using, and they have had a great deal of success. And of course, we have had the 2 cases of the nurses. So yes, it's always important to get the training out. And my background is HIV, and it's a similar case that we saw when HIV first came on the scene. We needed to rapidly get out and train nurses who always represent the front line when something like this occurs. And they were able to quickly pick up the universal precautions and successfully treat and provide compassionate care for people living with HIV, and I have every reason to believe they can do that for Ebola.
You heard from the Doctors Without Borders, and he said that the World Health Organization, the United Nations, they're finally sort of up and running, but they're still not there. Plus, even governments themselves are having a hard time mobilizing people to do this work. And so a huge burden is being put really on a very few. Why do you think there has been such a time delay in getting necessary resources there?
Well, again, particularly West Africa has never really had the tools they needed to protect themselves against infectious diseases. It's always been a concern when we travel. We always bring our own PPEs to be sure that we have some, and we leave whatever is not used and share while we're there, so that our colleagues, our colleagues can have the benefit of protective equipment. So there's not going to be. It isn't as though there'll be a few shipments and they'll have what they need. This is going to be an ongoing problem for quite a while.
Yeah, exactly. And there were a couple of hundred specialists before the outbreak. Now a lot more people being trained and gearing up. All right, Donna Gallagher, thank you so much. We appreciate your insights on that.
Thank you.
And coming up, new